Assalamualaikum. Today's topic is cannabis indica poisoning. It is a delirium poison. Cannabis indica is also known as cannabis sativa or Indian hemp. In Pakistan and India, it is also known as hashish. The active principle is a fat soluble oleoresin known as cannabinol. It is a delirium poison that stimulates the CNS. We will divide cannabis indica into 4 categories: bhang, majun, ganja, and churs, also known as hashish. Bhang is the least potent and churs is the most potent. Bhang contains an active principle of 15%, majun contains an active principle between 15 and 25%, and ganja contains an active principle of 25%, and churs contain an active principle of 25 to 40%. Bhang is least potent. It is taken from leaves and shoots and is given in beverages. Majun is a sweet meat with bhang and causes grandiose deliriums. Ganja gives a rusty green color and a characteristic odor. And churs is the most potent one. It gives dark green to brown color. Now, in overdose, it causes psychological dependence or intense craving in children and is given in chocolates or sweets to them. Then we get to know what is marijuana, pot, or Mary Jane. In Mexican terms, its literal meaning is pleasurable feeling. Now we come to the signs and symptoms. I remember these signs and symptoms from a party boy. First, it will cause euphoria and then narcosis. So the symptoms of euphoria are the person will feel pleased, cheerful, well-being. There will be a feeling of well-being, and he would be very talkative. The appetite will increase and there will be increased sexual desires. There will be loss of perception of time and space, and there will be visual hallucinations. Then comes the next step, that is narcosis. In the stage of narcosis, there will be giddiness, confusion, and ataxia. There will be then generalized anesthesia due to numbness, and the person will then sleep for 6 hours. Due to chronic use of cannabis indica, there is a term that is known as hashish insanity, in which there is an increased tendency of delusions and crimes, mostly sexual jealousy crimes. The fatal dose for cannabis is 2 mg for churs, 2 grams for churs, 8 grams for ganja, and about 10 grams for bhang. The most potent will have the least dose. The fatal period is about 12 hours. The treatment will include stomach wash, saline purgatives, strychnine, a hypodermal injection of strychnine. Then we can give strong tea or coffee by mouth or per rectum, and then we can also give artificial respiration. There are no as such characteristic post-mortem symptoms except the death is due to asphyxia. The medical legal significance is that it can be accidental or due to overindulgence. It is mostly given through chocolates to children. And then there is a term known as run amok, which is very important. Run amok is due to chronic use of cannabis or is due to first time use of cannabis. It is characterized by a forensic desire to cause pain and murder, and the murders are first of all towards the real or imaginary enemies. Then it comes to whoever comes in the way until the homicidal tendency is there, and then when the person gets normal, the person may commit suicide or surrender to the police.